Hi, I'm Dr. Meegan Gruber with Artistic Liposuction and Plastic Surgery in Tampa, Florida. And today we are going to do a very common operation. We're going to do an implant exchange. So just follow me and I'll walk you through a breast implant exchange. So we're going to be entering the surgical area. We have to have our proper attire. Come this way. So this is done in the surgery center. We do not do this in our office as we need to have more of a sterile environment, and we do use full anesthesia for this procedure. Okay, so I'm just about to scrub for surgery. Everybody always wants to see, what's your day like? Well, before we go in and operate, of course, we have to get clean. So this is a surgical scrub sink. Okay, so 5-minute scrub over, and now we're gonna head over to the operating room and get started with the implant exchange. The patient has gotten her anesthesia started, and this is the way we walk, so we stay sterile. And we're gonna just go to OR number 3, and we'll show you everything about changing out implants. So we're going to start the implant removal and replacement, and I start by injecting local anesthesia into the incision. So I'm just pulling them out here to see what a saline implant looks like when it has nothing in it. Her capsule comes all the way out here and all the way in there. It's a very large capsule. It goes like pretty much to the middle of her chest, all the way to the side of her body here. So if she wants a small implant in there, I have to not give it such a big pocket. So that's what I'm going to be doing next. Alright, so the capsule is scored so that I can bring the lateral edge of the pocket for the implant more medial, so that the implant stays more in the center of her chest rather than falls to the side, which is a problem a lot of people have with implants. As they get bigger and bigger, they tend to fall to the gravity side. That's all. So really just a piece of silicone that used to have saline in it. This is a saline sizer, and I'm going to use it to look at the shape of the pocket, because she's downsizing her implant. She's like going half as big. She had 450 in, and now she's going for like a 250. So it's going to be really important to see where the implant sits and adjust the shape of the pocket inside so that the implant doesn't all fall down here. I'll take the second sizer, please. Alright, so now we're going to fill up these implant sizers to 250, which is the size she was looking for. Three? Yeah. So you see how this implant's falling down? She's got this big cavity here. We'll show you how it looks with her sitting up. This side, I have brought the capsule in. I plicated the capsule, we call it, so it should sit more medially. And this will prevent the implant from falling back and in. The pocket's nice and round here, nice and round on the bottom. And you see the difference here. This will fall to the side, leaving very little cleavage in the middle if we don't placate it. So this is why you can't just take an implant out and put another one in if you're changing the size, or if you want the shape of the implant to look different. You have to take into consideration what pocket you're putting that implant into. Okay. Okay, so I'm plicating the lateral aspect of the implant capsule so that we can medialize it and have the implant come more towards the center of her chest. It's kind of a small incision and a deep hole, so you can see the light shining through here. I don't know if you can tell it. Remember, the implant was falling down. Now that we're plicating it up, that it'll hold the implant in the right place. It's kind of like an internal bra. Okay. This is a Keller funnel. It allows me to put the implant in without touching it. Okay, there's a sidedness to the implant, so this is the bottom. I insert this here and slide it in. Simple as that. See how smooth and easy that is? See it?
Yeah.
Satisfying. Alright. Ready? Oh, so satisfying. Okay, so the bandages are on. The support tape is on. We're going to put her in a support bra. You can see the plication sutures in the sides of the capsule are holding the implant towards the middle. She's got good cleavage here. She's got good roundness underneath. And when she sits up all the way, it even falls nicer into the bottom pocket. So we'll show you the after pictures when she comes back in for her follow-up visit. But that is basically an implant exchange and capsule plication. Thanks, everybody.